Hello everybody, my name is Mona. Welcome to another journal video on 668. Today I'll be making my last journal, reflective journal. So first of all, I'll be talking about my goals at the beginning of this semester, at the beginning of this clinical rotations. I had a couple of goals at the beginning of this rotation. First of all, I wanted to be very confident enough in establishing therapeutic communication between me, my clients, relatives and people and whatever my patients and people around me. Secondly, I wanted to be very confident whenever I face unfamiliar circumstances or unfamiliar situations or unfamiliar clinical settings. Thirdly, I wanted to be more confident in medication management, monitoring labs, readjusting medications based on patient responses. Fourthly, I wanted to be more confident in diagnosing clients, diagnosing patients as they present with different signs and symptoms. To an extent, to a very good percentage, I would say I am not where I used to be when it comes to therapeutic communication, because I realize that it is one of the basics, it is one of the foundation for me to have for me to have for me to have good patient provide a patient relationship. So I would say that I am not where I used to be with communicate therapeutic communications. In as much as we're still learning, we're still like, but we are like heading towards being a provider. I am more confident with these goals at this point. Again, I want to talk about my feelings, my prejudices, my bias during this clinical experience. First and foremost, I realized that most of the times I could feel more frustrated. I could feel frustrated, especially when I face unfamiliar circumstances, especially when I face tough situations. Sometimes this tell with my reactions, this tell with my emotions. So however, I got some feedbacks from my preceptors and instructors on my behaviors. So this has helped me to work towards my frustration. This has helped me to work towards my frustration. Again, I try to I try to like soak myself with being empathic and active listening thing. So this has helped me a lot, especially when I'm faced with tough situation. So again, talking about sometimes I could be a little bit biased, especially when patients are not like compliant with what they are told to do, especially patients with alcohol use disorders. So sometimes there could be these reactions, innate reactions that I display, but I do not know that I display them. So, but when I get feedbacks from my preceptors, this has helped me to work on those behaviors, to become more self-aware, like to become more aware of myself, my feeling, my emotion. That way I've been able to work out something. That way I've been able to like that way I've been able to work on them to be like a better individual, to be like a better provider. During this clinical experience, there was anxiety. I could remember the first day I went to one of the behavioral centers, hospitals for my clinical rotation. I was super anxious because I didn't know what I would expect. So, but one of the things that made me to relieve my anxieties and uncertainties, first of all, I try to familiarize myself with disease conditions, what I'm expected to do, try to familiarize myself with criteria for making diagnoses, especially the DSM-5. So that way I became more knowledgeable. That way I became a little bit aware of what I'm expecting a patient to present with. I started reading about my medications before I get to the clinical orientations. That way, in clinical rotations, that way I became like more conversant. I became more knowledgeable. I became more oriented, like more knowledgeable about these medications. That way, it kind of reduced my anxiety, because at that point, I know a little bit. I know of a little of what is expected rather than not knowing. Because one of the things that put me off, one of the things that makes me super anxious is when I do not know what is expected of me. When I'm not knowledgeable about anything, that way I could be more anxious. Yeah, talking about reflective practice. Reflective practice has been very beneficial to me, even on my day-to-day activities as a nurse, even though during these clinical rotations. It has been very relevant to me, and it's something I'm gonna hold on very dearly to. Um, Reflective practice has made me to like reflect on what I have done during the day, especially during tough conditions, tough situations. It has helped me to like work on it. It has helped me to like, a kind of at the end of the activities, at the end of my everything, anything, at the end of my clinical rotations, I write it down on a paper. That way I try to know what I do what was expected of me. Did I do what was like, what is the gaps that I need to bridge? I try to work on them. Sometimes when I do not have time to write on these things, I try to discuss this with my preceptors or with my peers. That way I'll be able to reflect on what has gone, like I have experienced. I try to seek their opinion. I try to find out what they would have done if they were in my shoes, or I would ask questions. That way, reflective practice has been really, really relevant. It has helped me to adjust. It has helped me to bridge the gaps. It has helped me to improve my knowledge on my previous experience. Yes, like I said, reflective practice is something that has been relevant to me. I got to know about reflective practice in my early days as a nurse. So then we got to do like at the end, whenever you have okay, uh, when you want to like revalidate yourself, like when you want to like do your licensing or your licensure, we do the you have to write like a reflective practice, like what you've done before, like you've not done right, how you should have done it. So that way I got to know about reflective practice. And most times we before I got to know about the we've been doing it as a student nurse. Sometimes when I go home, I try to reflect on what I my experience during the day. So that is also reflective practice. But at that stage, it was not like I didn't have enough information about it. So but with time and with experience, I got to know what reflective practice is all about, try to embrace it more. So reflective practice, I would say, it's something that has been very helpful to me previously, and it's something I will continue to embrace. It's something I will continue to work on because it helps me to be a better version of a nurse. It makes me to improve myself as a nurse. Also, now that I'll be a future psych health nurse practitioner, I believe that this reflective practice is going to be very, very helpful to me. In conclusion, I would say that this clinical experience this semester in generally has stressed me a lot. It's really stretched me, but I'm very confident to say that I'm a better person in knowledge, in skills. I've gained more. I've become conversant with psych and mental health. So I would say that I'm leaving this course, I'm leaving this semester, I'm leaving this program with this confidence and with this knowledge of that I'm living with full confidence that I am knowledgeable in psych and mental health. In as much as we continue to learn on a day-to-day basis, but I believe that so far so good. What I've learned from this course is gonna form a foundation of what I'm gonna experience out there as a provider. Thank you very much.